News in Washington, I'm Janine Herbst. OPEC and its allies have agreed to a historic cut in oil production after days of talks. But analysts say oil markets won't be balanced because the coronavirus pandemic slashed oil consumption. NPR's Camila Dominowski has more.
The oil cartel has agreed to cut output by almost 10 million barrels per day for the next 2 months. That's more than twice as big as OPEC's total cuts during the 2008 financial crisis. Technically, it's OPEC plus making cuts now. That includes non-OPEC countries, including Russia. Russia and Saudi Arabia have been waging a price war for more than a month, so this deal is a major turning point for them. And another non-OPEC member played a starring role in these talks as Mexico successfully pushed to reduce its share of the cuts. Even with this deal, oil prices are expected to stay low. The pandemic has reduced demand so much that analysts say there will still be a huge glut of oil. Camila Dominowski, NPR News.
As the number of new coronavirus patients admitted to New York hospitals falls to the lowest level yet, officials are weighing when to reopen the region. Charles Lane from member station WSHU has more.
On the same day that 758 people died in the state from coronavirus, a dispute erupted over how and when to reopen schools. New York City Mayor Bill de Blasio says they are to remain closed for the academic year. Governor Andrew Cuomo says it's too soon to make that decision. Cuomo compared reopening the region to a complicated jigsaw puzzle between schools, businesses, and transportation.
You have people who live in Connecticut who work in New York City. You have people who live in New York City who work in New Jersey. This all works as one, or it doesn't work.
Cuomo added that bringing testing to scale and Congress passing another stimulus package are also required to reopen the country. For NPR News, I'm Charles Lane in New York.
Italy has recorded the lowest number of new deaths from COVID-19 in the last several weeks at just under 20,000. But with 431 deaths in the past day, the pandemic has had its lowest daily rise since March 19th. NPR's Sylvia Pajoli has more.
Even on Easter Day, the Civil Protection Agency held its press conference in what has become a daily TV appointment for a nation in lockdown for 34 days. It's a painful holiday weekend for Italians accustomed to spending Easter in the countryside or by the sea. Worried about a surge in lockdown violations, officials heightened surveillance across the country. Helicopters and drones are on the lookout for signs of barbecue smoke from terraces and gardens that could suggest too many people are congregating together for an Easter picnic. Police roadblocks have been increased to prevent escapes to vacation homes. Rome Mayor Virginia Raggi warned, "No night driving, we will catch you." Sylvia Poggioli, NPR News, Rome.
And you're listening to NPR News from Washington.
It's 4 minutes after 5 for Maine Public Radio News. I'm Ed Morin. The Maine CDC is confirming increases in the numbers of residents and staff who have tested positive for COVID-19 in the Skilled Nursing and Assisted Living Center in Augusta. CDC says as of today, 41 residents and 14 staff members at the Augusta Center for Health and Rehabilitation have tested positive for the disease. The Portland Press Herald's reporting that on Friday, only 4 cases were reported at the facility. In a press release, the CDC says 1 resident at the Augusta Center who tested positive for COVID-19 has died. In its daily update this morning, CDC reported that the number of confirmed cases of COVID-19 in Maine had increased to 633, 17 more than yesterday. No additional deaths were reported. CDC says the increased number of cases at the Augusta Center for Health and Rehabilitation will be reflected in the COVID-19 data the state releases tomorrow. Both Central Maine Power and Emera Maine say while they expect to restore service to most of their customers by the end of the day today, some may not have power for at least another night. As of 4 p.m. Sunday afternoon, CMP was reporting 32,000 homes and businesses without lights, down from a peak of 203,000. Emera Maine was still working to restore power to just over 10,000 customers, down from a peak of 75,000. For Maine Public Radio News, I'm Ed Morin.
Support for NPR comes from NPR stations. Other contributors include Progressive Insurance, committed to offering a streamlined shopping experience where home and auto can be bundled together. Now that's Progressive. Learn more at progressive.com or 1-800-PROGRESSIVE.
In the weather tonight, increasing clouds with developing showers before daybreak. Lows tonight from 34 in the mountains, 42 along the coast. For tomorrow, on Monday, periods of rain statewide, a few thunderstorms, some dense fog developing north over Rumford and Bangor. Highs tomorrow from 50 to 60 north to south. Portland is partly sunny, 50 degrees. Rockland fair, 46. Bangor fair skies, 49 degrees.
This is All Things Considered from NPR News. I'm Tom Chelton, sitting in for Michelle Martin. It's April 12th, Easter Sunday. Back on March 24th, President Trump said he'd like the country opened up and raring to go by today. But that point is still a ways away. The coronavirus is still spreading. Americans are still dying, more than 20,000 so far. And public health officials say that while we're approaching the peak of the outbreak in some states, we're not there yet. Meanwhile, unemployment is reaching Great Depression levels. Food banks around the country are overwhelmed with hungry families waiting in their cars for hours, the lines stretching for miles in some places. The virus has hit minority and low-income communities the hardest. One place where that's evident is Michigan. In fact, the state has created a task force to focus specifically on racial disparities in the pandemic's impact. That task force is chaired by Michigan's Lieutenant Governor Garland Gilchrist, and he joins us now from Detroit. Lieutenant Governor, thanks for joining us on this Easter Sunday.
Tom, thank you for having me, and happy Easter to all the listeners who celebrate it.
Same to you, and I hope you and your family are doing well.
We're doing okay. I mean, I have to admit, this has hit the state of Michigan very hard, and my hometown of Detroit in particular. On a personal level, I have lost 15 people in my life to COVID-19 and have a number of others in my life who were positive or were quarantined, or some who were hospitalized in the extended part of my family. So we're all working to get through this together, and we have to coordinate and stick together in order to make it work.
Well, we're sorry to hear that has hit you in particular so hard. And of course, the epicenter of the outbreak in Michigan is Detroit. Across the city, how bad is the situation there right now, Lieutenant Governor?
Well, I think people are quite anxious. We took aggressive action through Governor Gresham Whitmer and I by issuing a stay-at-home, stay-safe order, and so certainly people are working hard to mind that, but it's difficult. I think, particularly in communities like Detroit and Black communities and communities of color, when things get tough and when there is a high anxiety moment, we often come together to cope with it. And what is particularly dangerous about COVID-19 is that coming together is what puts people at great risk of infection and possibly death. So it's caused people to try to invent new mechanisms for coping, and I think that everyone's just really trying to struggle to get through it.
And this task force that you're directing, Lieutenant Governor Gilchrist, on racial disparities, what have you been able to figure out or learn so far about the disparity of impact in your city?
Well, the state of Michigan was one of the first states to report out COVID-19 test results and deaths by race. And what we have observed is that while Black people make up 14% of the state of Michigan's population, we have accounted for 40% of the deaths. And so clearly there is something going on with the mortality rate and when it comes to Black people. And so the task force is looking to find ways to intervene and to respond to that mortality rate directly in the context of COVID-19, but also recognizing that there are a number of factors that have contributed to poorer health outcomes in communities that are fighting poverty or in communities of color across the state for a long time. Things like social determinants of health, poverty, lack of consistent access to the healthcare system, having to do things in the context of this virus, like take public transit to get to your critical infrastructure job.
Well, what are some of the things that you can do? I mean, given those environmental and kind of structural factors, what kind of mitigation is possible?
I think there are several things that are possible. First is making sure that we have as clear of understanding of the problem by data sharing and information sharing. There perhaps are particular interventions that can be taken to protect people who are riding public transportation in order to get to work or to get to critical resources like groceries. I will say that one thing that is going to be critical in our interventions and frankly in getting ahead of this pandemic for the entirety of our population
is more access to testing resources. We're testing more and more people every day, but we probably may need to have specific testing strategies for communities of color, particularly Black communities in densely populated places like Detroit. We're going to need more so that we can truly have a sense of the community spread.